The most common infection in the human body is the common cold. The second most common infection in the human body is a dental cavity. What happens with a cavity is this is the enamel, the real hard coating on the tooth, the blue, the bulk of the tooth here, and this is where the nerve and blood supply is. A cavity starts as a porosity in the tooth and you lose some of the tooth structure. You get these little porosities starting, or sometimes those will show up as white areas on teeth. With really good brushing, flossing, limiting the sweets in the diet, and also if you have the type of saliva that helps minimize cavities, these areas can actually heal back. If there's a lot of sweets in the diet, if the saliva that you have is such that it doesn't help recalcify teeth, and if the brushing and flossing leaves germs on the teeth, the cavity, the porosity, tends to continue and you get more and more porosity. Eventually what happens is you lose part of the tooth structure and you have the actual cavity, the hole in the tooth as it were. Now this doesn't bother at this particular stage until the cavity keeps progressing, the germs stay in this little area, so now no matter how much you brush and floss and limit your sweets, there's still the germs staying there because they can't get cleaned out, and the cavity keeps progressing. Once it gets to the dentin, the bulk of the tooth here, then it starts to get sensitive for you. Usually not very sensitive, but once it gets here, because the dentin is softer, the cavity really tends to mushroom out. You get a lot more loss of tooth structure, and now it'll start to get a little bit sensitive as you get close to the nerve of the tooth. If you wait till it throbs or aches for no reason at all, that means the cavity has gotten into the nerve of the tooth, and the only treatment at that point in time is either a root canal or removing the tooth. So that's why I recommend regular dental visits, because you catch these porosities at an earlier stage. You can do the filling. It's just a filling. It's a smaller filling. No problem. Also, we get to reinforce the brushing, flossing, dietary issues for you to help minimize cavities. My whole goal is to help minimize cavities for patients as soon as possible.